Great. Hello, everyone, and welcome to this webinar from the AI Nurses Network. Today, we've got a great nursing researcher from Finland with us, Dr. Frank Kiwanuka. He's based at the University of Eastern Finland, and he's going to talk about the research he's been doing around artificial intelligence. So over to you, Frank.
Yeah, thank you, Dr. O'Connor. It's a privilege to share with the audience of the AI Nurses Research Network with some of my activities that I've been doing throughout my career at first, and then I'll pivot towards my current research interest in AI in healthcare and nursing research practice and education. So at first, I'll talk about my early career track record, and then I'll also talk about how it led me towards my current interest in AI in healthcare. So my background as a nurse, I've worked in the intensive care unit. So this focus in the intensive care unit where we usually have a large amount of data that we generate from the patients that we are usually monitoring on a continuous basis is one of the reasons that actually led me to the interest in AI in healthcare. I was curious about how this amount of data from the ICU patients can actually be used more effectively rather than just collecting the data and looking at it on a continuous basis. So my early career research looked at interventions that can be used to improve the patients and their family well-being in intensive care units. During my doctoral research, I actually looked at a nurse-led intervention that included cognitive and emotional support for patients and their families in intensive care units. And this actually, at the end, we had a quasi-experimental design where we tested the intervention. And I found out that using emotional and cognitive techniques, we actually can support patients and their families in intensive care units. This kind of background laid a very strong foundation for me to transition to the focus on AI in healthcare because during my doctoral research, I realized that there is quite a large amount of data that is basically not utilized to support the patient's recovery and also their family's recovery. So at the moment, I have focused on using data that is generated from the patients to support their ICU and post-ICU trajectory. So just to get back to a little bit of introduction that I actually I might have skipped. Currently visiting or postdoc research at the University of Eastern Finland in the Department of Nursing Science. Also based at Memorial University of Newfoundland and Labrador in Canada as a postdoctoral research fellow as well. In these two positions, I actually have the possibility to work in two culture settings in Finland, as well as that in Canada, which is also quite an interesting bit of my research as a person. In addition to that, I have two tracks that I actually do at the two settings at the Memorial University of Newfoundland Labrador. We have a methodological project that we are looking at. This is basically focused on mixed methods research. And at the University of Eastern Finland, where I conducted or conducting my postdoc period, I have focused mainly on AI for ICU patients and their families. So here, I'm interested in looking at formulating an AI tool that actually can be used to predict the care trajectory for patients from the time of admission in the ICU to 1 year of post-ICU discharge from the hospital settings. And there is a foundation that, or some early research that I've already conducted in one of my publications that I've recently published in the Journal of Advanced Nursing. At first, I've looked at what would be the role of nursing leaders to actually interpret or transition the AI, which is, I should say, it's not a very new tool in any sector, but I should say in the healthcare sector, we can say that it's actually something quite new to us. So the major issue that we are actually having is that we are having very many tools, AI tools that are developed, but these are actually, majority of them, they don't transition to the bedside per se, or they are facing very hard, the developers themselves are facing very hard time to get these tools deployed. And what we thought was that one of the issues here could be that the nursing or the nurses' leadership or management is not actively involved in the process of design, development, and deployment of these tools. So in this review, we looked at basically what are those tools that have currently been developed specifically for the different aspects in nursing. We had a particular focus for this review. We looked at those that are used for the nursing workforce management, and we also try to integrate what would be the role of the nurse leaders in this aspect of the AI tools as they get transitions to the bedside. So one of the key findings we found that there is quite a number of tools already that have been developed. However, the extent of involvement of nurse leaders is currently very, very minimal, if at all, if there is any that is being conducted. So we find that many of these tools are being developed by technical developers. So this makes the situation that the tools are so much technical focused rather than being value focused, in a sense that what would be the value or what would be the level of engagement of the nurses or the patients who are going to benefit from this. This hasn't been the case when developing these tools. And one of the key things that we have stressed from this review is that nurses or even their leaders should be engaged early on in the process of designing these tools so that they are not just end users, but they are also part of the process of development through to the phase of deployment of these tools in healthcare. We hope that by doing so, this would actually increase the rate of adoption of the AI tools in healthcare and also the value that we expect from the AI systems. Yeah. So going forward with that kind of focus from that point, looking at how these nurses can actually, what are their other aspects that are needed. For example, there is an aspect of literacy. For example, they are not by our training as nurses, we actually usually we are not focused on the technological aspects of any kind of digital health interventions. We are not developers per se. We are clinicians in a sense that we work with real patients. We don't do the coding in a sense. Of course, there are nurses who are also able to do that, but majority of us in the kind of training that we already received, we don't have those kind of qualities. But the main issue is not all about turning nurses into coders or developers of tools, but there are points where we actually can have a certain extent of literacy, the knowledge of how these tools can be used, in a sense that we are we are one of the major people that are responsible for the data that is going to be used to develop these tools. And also we are the stewards or the gatekeepers, in a sense that we are the people who are responsible for maintaining the privacy. So if you look at these aspects, we do need nurses, not even for the future, but for the current healthcare system, because we are already using the AI tools. We need nurses who are able to use the tools effectively in a way that they are literate about AI systems in terms of knowledge to use them, in terms of data privacy, in terms of ethics. I should say that networks such as the AI nurses network is a very essential network, as it's also timely in a sense that it's promoting this very useful aspect of the healthcare system. Yeah. In a sense that AI is no longer the future as we used to think. It's the now in all healthcare systems. So nurses, who are the largest workforce, we really need to have those skills, the literacy, and the ethical competency that is required to use these tools. So it is kind of background. It's one of the things that is driving my interest to explore different aspects of research in AI. One of which we've already started with looking at the extent of the data in a review, and we've also tried to set pace for research. For example, there is a recent letter to the editor that we have also published in the journal Nursing Research. So we have called the title of this paper was Nursing as a Lingua Franca for Artificial Intelligence in Patient Care Trajectories. The kind of reasoning behind such a title was that nurses are actually the key. They are like the bridge that is going to bridge the usefulness of AI to what is expected, the expected potential, for example, improving the care of patients, the healthcare outcomes that are expected from AI. Nurses will be key people to that. So that's the kind of background to that. Yeah. So yeah, that's been quite a lengthy kind of discussion about this, and I'll go back to Dr. O'Connor to kind of have some kind of engagement with our discussion.
Sure.
Yeah.
Yeah, thanks, Frank. It's a really nice
Mm.
summary because obviously you're still early on in your career, so you have lots of ideas for using AI in
Yeah,
critical
yeah,
care nursing.
yeah,
I
yeah.
guess, yeah, as a nurse, you kind of mentioned like how did you start becoming interested in AI? I know you sort of touched on it at the introduction when you started working in critical care, but yeah, how did you start
Mm.
doing research on it, I suppose?
I started my research in AI about 3 years ago, just immediately after at the stage of completion of my PhD. And the one of the steps that I took was to transition from the research that I conducted, basically looking at interventions for supporting patients and families in the intensive care unit, to the phase where artificial intelligence can be leveraged or used to support patients' trajectories, specifically in intensive care units and the wider care trajectories. So that was the point when I pivoted or picked up the interest in AI in healthcare or in nursing sciences as well.
Great, great. And do you have any advice for nurses, maybe, who want to learn a little bit more about artificial intelligence and sort of do AI research themselves?
Yeah, I could say that this is a very useful uh, topic or tool that all clinicians, including nurses, need to be very involved with, especially nurses. Most of the times, there could be a tendency that this is not our thing, but I should say that AI is basically our very thing, because first of all, we are the largest healthcare workforce among all people in the healthcare settings. So we should take a proactive role in engaging at various levels of AI systems. This can range from the design, from promoting literacy among nurses, to also the ethical bit of AI. It shouldn't be left to the people designing or the people coding, writing the code, but it should be by the nurses who are actually using these tools and collecting the data from the patients. We've always been one of the most trusted group of healthcare professions across all different healthcare systems in different countries. So the same thing when it comes to AI ethics is one of the major things. We should take the lead when it comes to promoting ethical use of AI systems in healthcare. Yeah, so our career researchers like me, and even more experienced researchers, even those who are still students, should pick an interest in one of the thematic areas of AI. There's quite a lot that can be explored in clinical practice, in education, as well as in the process that the AI systems go through before they are deployed at the bedside. So people or different researchers at different levels should take interest in that, so that we can keep pace with the rate of the AI tools development, with also getting to know how these systems are actually impacting patients' lives, as well as the nursing scholars, as well as also the nursing students. Yeah.
Great, great. Yeah, I definitely agree. Nurses need to get more opportunities to get involved in developing AI and involved in its governance as well. So my last question is, this is a bit of a tricky question, but where do you think AI will go in the future? And yeah, what kind of trends should nurses be keeping an eye out for?
Yeah, this is quite an interesting question, and it's very it's always asked on any AI meeting. I've attended a conference at the beginning of this year for the Association of Nursing Interventions and Outcomes. It's called Assembly in short. So that was one of the key topics that we already have looked at even during that conference. So I do think that AI is no longer the future. It's with us. It's only going to evolve. We are going to shift from things that we thought that we couldn't do with AI. We are shifting more towards having AI in everything that we do in clinical practice, in educating the future nurses. So I think AI is going to move towards not only supporting, for example, we've been using this mainly at the moment for scribing or getting our patient reports, but it's going to move even more, especially in the nursing discipline. It's going to move more. At first, we were thinking of, especially in education, we were thinking of how to block it, but then people transitioned from stopping it, from how they could actually ethically use it. And now people are almost, students and teachers are using it quite freely. But this is going, in the future, it's going to be more than just a tool that we use to support our activity, but a tool that is actually actively impacting how we do formulate the knowledge that we currently have on the clinical side, and also on the education side. It's going to be something that is also going to be a very useful thing for our patients to get to know about what we're actually giving them in terms of the medicines. Currently, they've been quite used to Googling or using a web search, a random search, but they've actually moved towards a phase where patients are also, in addition to the advice that they get, I've seen that now patients also use, like they have a second, I shouldn't call that a substitute, but they have a second therapist in addition to the therapist in the hospital or the caregiver. So we are moving, or in the future, or actually in a very near future, we're going to have AI being actively part of the care trajectory, both for the people providing care and also for the users or the receivers of the healthcare services. Yeah.
Yeah, great. Thanks, Frank. Yeah, I think we'll see more and more AI coming on stream all the time, which is
Yeah.
it's a double-edged sword.
Mhm.
There's good things about AI, but there's lots of concerns about it as well. So we definitely need more
Yeah.
research, I think, across the board in all areas of nursing. So thank you so much for your presentation. It was great and lovely to hear about what you're doing. And yeah, keep in touch with the network.
Yeah, sure. Thank you so much for the time to
Th-
talk about this. Yeah.
Thank you.